Hi, I'm Eileen McCabe. I'm a speech language pathologist.
I'm Gabriela Gonzalez. I'm a resource specialist.
And I'm Devorah Cohen, an occupational therapist.
And we're going to talk about specific cases and how we work together as team members to complete those cases, starting from the initial referral all the way to implementing services. Okay. So, first thing we're going to talk about is elementary age student and being referred for full evaluation. So occupational therapy would come in, and a resource specialist, a speech therapist, and of course a school psychologist. And usually they're referred by the teachers, right?
By the general education teachers.
By the general education teachers. I know at most schools they would go through a team first to make sure that they need special education, and then it would get to the step of special education. You guys have anything to add?
Or if they had early intervention, then the parents would expect that they want to continue the services they had, so then they're more involved in making sure the services occur.
Sure. Or if they're coming from preschool.
Right. No. Yeah, so you're talking about kids that already have services?
Say through regional center.
Okay.
But it would still be initial assessment.
And then, then they go, the psychologist would make sure that those who are transitioning in will get their assessments, even if the teacher hasn't met them yet.
So the first step would be, of course, getting an assessment plan. Warning all the specialists that they're on this assessment plan. Then you get 60 days to assess. And then we come together as a team, as an IEP team with the parents and sometimes the students, depending on how old they are.
Right, and as we were saying, that usually we would try to focus scheduling a meeting around the parents' schedule, because the parents and the children are really a unit. It's a family unit, and without the parent there, it's not an IEP.
Yeah.
Right.
There's no point in a meeting.
Right. Parents are the first people that are on that team, so we have to go around their schedules.
I've seen one or two exceptions to that, where maybe the child has gotten services and it's maybe a try, and they're not needing to. They don't feel like they need to come, and they're impacted with working and unable to make it, so they'll give permission. They'll give written permission, or maybe call in, because it's not a new big thing for them, and they know the child's going to continue services they've already had.
Yes, we do see that a lot. So, you guys want to talk about the initial IEP meeting and how that usually goes, and how?
Sure.
So normally kids are, you find an eligibility, and that's usually, it can be under speech, it can be under
learning disability.
Or it can be other health impairment, it's usually ADHD or emotionally disturbed.
Or autism.
And then
or in the case of cerebral palsy, would be orthopedic, and maybe low incident or more common, typical school-based.
Yeah, there's also intellectual disability.
So then at the meeting, usually the eligibility determines who the teacher of record is, so the person in charge of the case. I know some schools, I came from the East Coast where we had secretaries to do a lot of paperwork for us.
Nice.
Very lucky.
And now, from what I understand in California, that's very different. Most school districts put it on the teachers and the therapists to keep track. I know you were saying that you were in charge of all of your whole caseload in one town, and
for occupational therapy, right?
Which is crazy. And then I know all the paperwork you have to go through.
Yeah.
But for the IEP, the school district I was in, it was run by the psychologists, and they would coordinate everything.
That's nice.
And occupational therapy is only included if the psychologist determines that they have a likely need for a service that OT provides, because a child cannot just have OT alone, usually has to have speech or resource.
And with us, we usually have a TOR, which is a teacher of record, who is in charge of all the paperwork and scheduling the meetings and getting everybody together.
And then speech can also be a TOR. They would just be speech-only kids, though. They wouldn't have a resource teacher. So the teacher of record would do all the paperwork and keep everyone hopefully organized, and that's what we're trying to get to, how we would stay in contact. So I know when we worked together that Gabby was really good at staying in contact with me, and we just discussed all the time. If I went to her room, I say, I'm really worried about this kid, or this student's doing really awesome. Are they doing it, generalizing it? Are they doing it in your classroom? Emails all the time, staying in the loop. I always talk to our occupational therapists. I ask for recommendations too when working with students. Is this appropriate motor task? Can I be doing this with them? Or how can I get this child to sit still in my room or pay attention in my classroom?
And we also had our weekly meetings, which made it a lot easier for us to stay in contact, because we were all there in the same room every week. And we could talk about several kids at once.
We had special ed meetings, which was
Sometimes it's just monthly. But in any case, there's texting and just walking around the school and or driving between schools, which I had occasion to do a lot, or even driving out of the district for other situations, a non-public school or a low-incident classroom in the South Bay or something.
So to stay in contact, technology is great. Email, texting, phone
Essential.
calls, voicemails, all of that is huge to stay in contact. Face-to-face time is nice. I know one thing that we wanted to discuss was, what if somebody's not communicating with you? We've been really lucky to have nice team members to communicate with us. Like, I think we were talking about that.
Yeah, it's usually a pleasure. I look forward, and I think most of us professionals look forward to having contact with each other, because we give each other support and we get a picture of what the child is like, get confirmation of your intuitions before you do the testing and which direction to go in. And then after testing, you can talk to each other, forming goals and that coordinate. I would have to check for OT with the psychologist, so if they've done an initial VMI, I might want to follow up with the second and third part, which is the psychologist usually does the first part, but you can't repeat the test, so, but that's something that's relevant for occupational therapy treatment, especially for handwriting, which is a service that OT is often referred to because of poor handwriting.
So if we had a case where a team member was not easily accessible, or not responding to emails, or say they were traveling all the time, so we didn't have that FaceTime, we couldn't see them, do you guys have any suggestions of how we would deal with that?
I'd want to find out what the reason is for the non-communication. If it's just not being able to stay in touch, or just the difficulty of having to move back and forth, then I try to find a way, talk to that person and find a way that would work. I'm trying to think of another situation where they would be.
I think if somebody wasn't responding to my emails all the time, or my voicemail, I'd probably have to bring it to my supervisor, because it is, like you were saying, such an important part of the team. You know, parents are involved in the team, we're involved in the team, we're all working for this kid, and if they're not on top of it or responding to us, that's not doing the kid any
with
good.
the 60-day deadline.
Things like that,
And then rescheduling of meetings. I recently had a meeting that was supposed to occur, and a few days before they rescheduled because the parent couldn't make it. And I kept waiting to hear, well, did they reschedule it? Did they reschedule it? And sometimes teachers, parents, everybody's so busy. They have a long list of things to do, and sometimes if I know somebody who knows somebody, I'll say, oh, can you tweet, can you sort of ask them if they could take care of that? without having to go to a supervisor. If I can avoid going to someone superior, I will try.
Oh yeah, absolutely.
Yeah.
Try
everything before.
first.
Everything first.
Yeah.
But ultimately, this is we're legally
the kid.
bound, and we're advocates for the child. So
because we have legal boundaries, and if we don't do it, then
so
it's not good for us.
Right. If nothing else works, then we have to go to our administrator.
Just document. This is all the things I tried first. I tried calling. I tried emailing. I tried texting. I tried talking to one of their coworkers that they see all the time.
Right.
But it's fairly rare to have to do that.
Yes.
Yeah.
So. I don't think I've ever had anybody do that.
Not respond.
Yeah.
Do you ever have people that you disagree with you on, what you think is best for the child or going to goals?
Another team member?
Yeah.
Yeah, we've had some minor disagreements, I think, just on why a child is eligible for in a certain category or not. But I think we've always been able to talk about it and work it out. I don't think I've ever had we've never come to a meeting in disagreement. So I haven't had to work that out.
And that's all comes back down to the communication of staying in touch. Because if you go into a meeting without talking to anybody first, just going in blind, then they might throw something out there about, for me, if they said something about, well, their language is blah, 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 and they hadn't talked to me first, that would be not good. Because then I would say, oh, I'm not seeing that, so that's...
Yeah.
We don't want to disagree in the meeting.
Yes, exactly.
So that we're all on the same page with the parent.
Right. And
I might see it as an interpretation of behavior. So in OT, something that might come up is a difference between behavior problems is often something that's delicate. And is the child maybe have ADHD, or is it sensory, or is it an oppositional defiant kind of, those areas can look kind of similar when they're really little. And so parsing that out is another reason why we want to get together and kind of talk. What's the medical diagnosis as opposed to the school diagnosis? And what behaviors is the teacher seeing, and what are their complaints? Why are they coming for services? They're obviously feeling the child needs help and that the teacher needs help because it's hard to manage them in the classroom. So I wouldn't necessarily call that a disagreement so much as it's a puzzle that we all kind of figure out together.
Exactly.
Right.
It has the best way to serve, and how can we help the parents, and what's the parents' point of view, right?
And obviously you can't come to the meeting with all the puzzle pieces in place because the parent is an important part of that team. And so there are things that you have to work out in the middle of the meeting, but at least understanding where everybody is coming from, I think that's important before coming to the meeting.
And if possible, talk to the parents before.
Yes.
Right.
Absolutely.
On the phone usually, or if they come to the school, sometimes you see them coming to pick up their kid.
Yes.
You kind of develop a rapport.
And it's just so important to stay in communication with service providers because, like I was saying, it helps with how you write goals. It helps with what you're working on. You get suggestions from your colleagues of this worked for me, this did not work for me. But also just scheduling them. You don't want to be pulling kids at the same time. So unless you want to work together, which sometimes...
Co-treating. I love co-treating.
Co-treating is great.
And for me, resource and speech were really my favorite people to work with because often I was placed to work in a resource room, so I really get to know the resource teacher. And often I'm running over to the speech therapist room to consult with them about something going on with the child, or to see what they have to say, or to schedule. And I did have one occasion where we set up a program to coordinate between speech and occupational therapy to co-treat, and which was wonderful for both of us because one field stimulates the child in one way and the other one the other way. And often speech therapists will say, oh, whenever I have the child spin, or, some OT method that makes them talk more. So, maybe I would start out with some sensory input, and then the speech therapist takes over and is doing speech with them, and it's great to co-treat. Or to even coordinate if it's not even co-treating.
Right.
And for resource, same thing, handwriting, studying visual attention.
Yeah, I was able to do that a few years ago, not with Eileen, but with our previous speech pathologist. Our schedules just worked and our caseloads worked where we were able to co-teach some of the groups, and it really worked very nicely. We did it a couple times a week, and we were able to plan together and come up with some really nice lessons that dealt with both of our goals that we were working on, so it was really nice.
Yeah.
Yeah.
Sometimes I have a question with working with the school, or teachers' aides versus teachers. They have different roles that they play, and so maybe I want to consult with my other service providers to see how they're managing that, because the teachers' aides are often have a kind of approach that's more caretaking, and we want the kids to be changing and learning and implementing new techniques and encouraging them,
challenging them
to use your words. Or
exactly. There's been a few times where I've talked to occupational therapists or whatever teacher it is and said, how's so and so doing in your room? Are they showing this skill? And the teacher will just say are they using their words? And they use one word, one utterance. And I say, well, oh my goodness, in speech they are doing this. So that way they're speaking in a whole sentence and they're using all of their appropriate grammar and everything. So then that teacher or the aide or whoever is with them is very aware that they should be pushing them harder.
Right. And then you're able to share the strategies that you're using that are getting them to that place where they can do more. And then you can share that with them, and then they can use it in the classroom or whatever other specialist is working with them.
Yeah, and studies have shown that children, not just children, adults, everybody, when we're learning, we learn for the specific situation. And so I have more than one occasion seen a child who was capable and responding to things that we were doing in therapy if I'm pulling them out. But then when they're sitting at the table with their group, their teacher and their aide, they're reverting their behavior because they feel like, well, that's how I'm supposed to behave in that situation. And so you're right, it's like educating and showing them that the kid actually can, cut with the scissors, or write on the line, or, hold the pencil a certain way, or participate, not just pace around in the back of the classroom like you might see with a child who has autism behaviors.
So I think we've definitely established why it's so important to stay in contact. And I just had a question, because you said that you drive around a lot and sometimes you go to schools where no one knows you. How do you stay in contact with people when you're so busy like that?
Well, it's not that they don't know you so much as they don't know you as well. And then if they're having a change of personnel, say when I first come in the office, I have to sign in. Where do I sign in? So you establish that routine, but then if they're having changes, then I have to constantly be working on getting to know people and letting them know what my role is, and who should I talk to about this, and where should I take the child? Is it okay if I sit outside with them? Can I take them on the playground? And so you tend to establish, and I found that over time, especially if I had SDC classes, that those children would have a routine. I would have a routine with them, and I was welcomed into the special ed classes, and I would become part of their environment. So even though I'm going from school to school, so they know they'll see me on Tuesday. Another one sees me on Thursday. And I do become known after a while. It just takes a little longer. Yeah, and I'm spreading myself around, so it takes longer even at my home school.
So do you work with several different speech therapists and several different, obviously different teachers, but so you're on many teams.
Yes, and maybe working with outsourcing OTs that are working from clinics, or kids that are also getting OT in the sensory integration clinic. And so then I have to communicate with other OTs for an IEP meeting. Well, how are they doing at clinic? You know, how you're handling that goal, I'm handling this goal or two, and so then we have to kind of put our reports together. And then if I'm, like you said, driving really far and I only go there once a year, then I don't know those people. And you're just professional and friendly, and try to communicate ahead of time, especially. We didn't talk about older kids. Is that if they're older, they might be included in the IEP meeting.
Even in elementary, I'm sorry. Even in elementary school, I've included a lot of my students.
They choose to be there.
Yeah, they choose to be there, or you know, I encourage them to be there because I think it's really important. But go on, I'm sorry, I cut you off.
No, not at all. So then they become familiar with that there is a meeting, it's about them, and that there are goals, and so that they buy in, rather than you show up and just do something strange. So if I'm coming in right now, I have like some new students that had a previous OT, and so we sit down and we talk about what are your goals, and did you know there was a meeting, and did you know what it's for, and how do you feel about them, and it's nice to do that with the kids because then they take more responsibility.
Yeah, in the beginning of the year, I have all my kids tell me what their goals are with me, so that they know that what they're working on. They're not just coming to my room for games, playing, or prizes, whatever we do.
And it's especially good for some students because they don't want to be pulled out of the classroom. They don't want to get these services, and so then you tell them what they're working towards, and they really work hard at meeting those goals and really working at getting out of needing special education services, which I think is great.
It is, and I find that it's especially true with the older kids, junior high and high school. They're departmental, they're becoming more self-conscious about their relationship with their peers, and they don't want to be pulled out. It's embarrassing to be different, and so maybe I will call ahead to the classroom and meet them outside, and we'll go to the resource room, or maybe I'll do something with the entire class, or I'm there for everybody so they don't know that they're being singled out, you know. But you have to kind of work it out with each kid and each teacher, and it depends on whether it's a regular classroom or if it's a special ed classroom, because if it's a regular classroom, then you also have to follow the needs of the teacher. So I found it's really good to consider the teacher and the principals and everybody at the school as my client, as my professional focus as well, not just the child, so that I can consider their needs. And
which once again comes back to how important it is to communicate with
exactly.
All right. Thank you for listening. We hope that you agree with us how nice it is to work together as professionals. And happy holidays.
Happy holidays.
Bye. Thank you.